Last week, I watched a patient come into the ICU for ruptured brain aneurysm, also known as a brain bleed. Upon admission, she was unconscious and had fixed pupils, which means that they were dilated and would not change with light stimulation. So think about when you use a flashlight and you put it to your eye and your pupil will grow or shrink. Hers did not, and this is a sign of severe brain damage. She was rushed immediately down for a CT scan, which showed that she had a hemorrhagic stroke. She had no previous health concerns. Her husband said that she was very healthy and she ate a very well-balanced diet. She exercised almost daily, and within 24 hours, she would pass away. She had 2 kids and a husband, and she was only 22 years old. Hemorrhagic strokes are caused by excessive bleeding in the brain, as I had mentioned before with my story of a ruptured aneurysm. Ischemic strokes are caused by a blockage in the brain which restricts blood flow in the blood vessels. So when you think about a clot could be in the brain restricting those blood flows. In image A here, I have showed a hemorrhagic stroke, and in the pictures below it in C, D, E, and F, it is actually the coiling process that doctors will go in and coil out and eliminate that aneurysm, which will then not lead to a hemorrhagic stroke. Now, these are pictures on a CT scan or an MRI, which doctors can use to find them early. Stroke is a leading cause of serious long-term disability told by Grefkes in 2020. 40% of all strokes will leave moderate to severe deficiencies, leaving the patient to need cares. Now, some of these cares can be bathing, toileting, getting dressed, feeding themselves. And those who need this level of care are often needing to go to assisted living facilities or nursing homes. So in the slide here, I have pulled up the monthly median cost in my area, which is Milwaukee, and you can see that it ranges from home health aides all the way up to a skilled nursing facility, and the pay difference is substantial. You could need a home health aide and only have to pay $4,500 a month only. Or you could have to send the patient to a nursing home facility, and that could range up to almost $15,000 a month. And I don't know about you, but if I'm not working and I need to be cared for 24/7 in this nursing home, who's going to be paying for that care? Brain tumors are also another common condition that can be detected in early stages. Brain tumors can either be benign, which is non-cancerous, or malignant, which is cancerous. And as told by Robert in 2024, these tumors are typically known to be slow growing, which means that they generally don't begin to cause symptoms until the mass has become large enough to cause a problem. Early intervention not only improves the survival rates, but it enhances the quality of life for those survivors. In both situations, whether it's benign or malignant, CT scans or MRIs can find these and detect them in early stages to eliminate the tumor and potentially have minimal to no side effects. However, late diagnoses can lead to deficits such as memory loss, speech problems, paralysis, swallowing problems, and in a worst case scenario, even death. In this slide here, I have shown a picture of a brain tumor on an MRI scan. And on this percentage survival at 5 years, I'm really focusing on the GBM, which is a glioblastoma, which is a very low survival rate cancerous tumor. And here you can see that that percentage of survival at all ages is very, very low. So if we detect these early, potentially we would be able to eliminate or help these percent survival rates, because you're going to catch it before that mass gets super big. Now let's take a quick second to go over routine scans that are already being used preventatively. Colonoscopies, for example, are normally advised for adults when they hit 45 years old. However, in the last few years, rectal cancer has increased in a lower age group, resulting in younger people needing to be screened. Mammograms are also another scan that's normally covered after you hit 40. Mammograms are used to look for abnormal growth in the breast tissue, and you're also seeing that younger age groups are needing more mammograms. I'm 32 and I've already had 2 ultrasounds and a mammogram. Because of preventative screens, we've been able to save so many lives. From breast cancer to rectal cancer, by using MRIs and CT scans, we're able to find cancer in earlier stages and be able to drastically change the mortality rate. All I'm asking is that our insurance companies allow us the option to choose if we want scans included in our premiums. What this does is it gives us the opportunity to have scans and be able to find things sooner, such as your strokes, your aneurysms, and things of that nature. We would have been able to save her life, the girl that showed up in the ICU last week, if we had been able to do these scans for her prior to her coming into the hospital emergently. She was only 22 years old.